Hand hygiene refers to hand washing with soap and water or the use of alcohol-based hand disinfection. Hand hygiene is the single most important measure to reduce the transmission of microorganisms from one person to another or from one site to another on the same patient. It is important for everyone, especially caregivers, to wash their hands properly. This is the single best way to prevent the spread of infections. Hand washing can help keep you from getting sick. It is easy, it doesn't cost much, and it works. When decontaminating hands with an alcohol-based hand rub, apply product to palm of one hand and rub hands together, covering all surfaces of hands and fingers until hands are dry. When washing hands with soap and water, wet your hands with running water and apply enough soap to cover all hand surfaces. Rub your hands together to make a lather. Rub hands palm to palm, right palm over the back of the left hand with interlaced fingers and vice versa, palm to palm with fingers interlaced, back of fingers to opposing palms with fingers interlocked, rotational rubbing of left thumb clasped in right palm and vice versa. Clean around and under fingernails, especially if you have long fingernails. Rub wrists of both hands. Do this for at least 20 seconds. Rinse your hands well under running water. Use a clean towel to dry your hands or air dry your hands. Use a clean paper towel as a barrier between the faucet and your clean hands when you turn off the water. If you use bar soap, use small bars. Set the soap on a rack that lets water drain. Thank you for listening. Please like and subscribe for more health tips. Don't forget to ring the bell. Be safe and be healthier.